And the last presentation will be from my side. Okay. I will show you in a short some of the projects realized here in Croatia in application of additive manufacturing in production of patient-tailored implants from bone cement. So I hope that you can see my presentation. I will not spend too much time about getting the data required for the preparing those implants, but just a few words. You can have a few different approaches in getting those data. First of all, if you need only outside surface of your of the body of the patient, then you can use optical lasers, optical and laser scanners, excuse me. And if you need internal organs or bones from the patient, then you have to apply different type of technology in order to get necessary data. So after that, the second step is segmentation. So in case of using those CT scanners and an MRI, and you must remove everything which is, I should say, noise from the result of the this type of scanning on this type from this type of data, in order to get only the part of the body or the part of the patient that you really need it. So this is a second approach, second step of our approach. And the third one is application of additive manufacturing in order to produce mold for casting the implant from bone cement. And the question is, why shouldn't we produce directly those implants? Okay, our technology and our materials are not certificated so that we cannot apply them directly for the patient, but in this indirectly way. So in our case, we are using the polyjet process, which is a material jetting technology, very accurate. So probably most of you know general information about the technology, but during the process you have a printing head, and in very small layers with very small droplets, you adding material layer by layer until the whole model is finished. You can see here our last project, a short movie about production of one of the molds for cranioplastic implant. This is the mold is not finished yet, but this is a final stage of production. So in next step, there is a production of implant in this type of mold. But I will go a little bit back into the history in 2014, when some surgeons from clinical hospital from Osijek asked us for help in their project of production of a cranioplastic implant. And when we heard that basic principle of production of this type of implants is application of hands as a tool. So as you can see here on this slide, on the left side of this slide was a common practice at that time for a production of this type of the implant. So you have PMMA, it's a bone cement, it's a two-component material. When you mix together those two components, you have a few minutes in order to shape the part, and during that time a certain amount of heat is generated, so you hold in your hands quite hot piece of material which you have to shape according to the patient needs. And sometimes it's very, very difficult or even impossible for produce very precise part which will follow, for example, the curve of the patient skull. On the other hand, in our approach, we have opportunity, according to the scan images of the patient and the segmented data, we have opportunity in virtual environment, in specialized softwares, design. We can design a geometric shape of implant and then design a negative of this implant. It's a mold forecasting a future implant. So in this case, you can see that the implant perfectly fits on the patient. So I should say that probably the patient and as well as the surgeon are much more satisfied in this case. So I will show you a few examples, just shortly, a few examples of this kind of projects. You already saw a few slides about this segmentation, so I will not spend too much time on explanation of those figures on upper side of this slide. This is the mold you saw the movie few minutes ago, and this is a production here on this slide, production of the implant directly in the surgery during the surgery. So my question was in 2014, okay, why didn't you prepare this implant at least day before, and you have enough time to sterilize it, so you don't have to bring the mold inside the surgery room. You don't have to sterilize a mold. But the answer was that maybe one of the greatest advantage of this material compared, for example, to titanium. You saw today that there are a lot of titanium implants that can be built also into the patient. But one of the most advantage of this bone cement implants is that you can apply also antibiotics together with this material. So the material will release antibiotic as soon as you complete production of the implant, as soon as your two components are cured together. So this means that if you will prepare an implant one day before, the patient will be shorter for this 20 or maybe 24 hours of releasing the antibiotics. So this is the reason why the implant is produced almost immediately before the production, built into the patient, so that patient received maximum dosage of the antibiotics. So this is the first case for our. This was the last case. Excuse me. This was the last case that we have finished in June of this year, but this is the first case that we have finished in October 2014. And this is the case from which we learn a lot. Okay, the process flow was similar, like you already saw in few slides in my colleagues today. They showed you maybe a few times this chain, data chain, and all the activities. So here we produce just a part of skull and the shape of the implant by polyjet technology. We ask surgeon to approve that this is okay, and then we have to produce a negative, a mold in which this implant was cast. So this is the example, this first example of the patient. This is the surgery, and here you can see X-rays with almost perfect fit of the implant inside the patient. Okay, one thing more, after the production of the implant, you have to also predict those connections with titanium plates and bolts. That was another patient, the same year, but two months later. Really huge implant has to be built into the patient. And as you can see here, again, X-ray from the patient show that we have really good results after the production of the implant. 1 year later, we have another example. In this case, it was the production of vertebra. We have one patient with cancer in vertebra, and we have to replace one portion of this vertebra. So we have produced a mold. Again, the process was the same. And here you can see the steps in the surgery, during the surgery, in production of implant. Here you can see a surgeon inject the PMMA inside the mold, and after a few minutes, when the material is cured, he can open the mold, adjust the implant, and build into the patient. And here is the implant inside the patient. So here maybe one remark: you also have opportunity to use titanium nets for this type of a surgery, but they are not tailor-made. So the surgeon has to adjust them to the patient. And sometimes it can happen that the surgeon will injure himself with this net. And if this happened, the surgery is finished for him, not for this day, but for maybe a few days, so that he needs to recover, and his wounded must recover completely before he can step into the surgery again. So in this case, there is no such a danger of for the surgeon to be injured. And another case that we have also is for printing of part of the mandibula. You can see here CAD models of mandibula, CAD model of mold, and this is a plate on the plate of our printer with printed parts of the mold. But as well, we also printed in implants, so that surgeon has a better visualization before built into the patient. So the surgery was performed in January 2016, and you can see here the results after the surgery. So a few remarks about bone cement implants, because you have, for example, opportunity to use also titanium implants. So what are the advantages of this material? First of all, this is a material which is in use since 40s last century. So there is almost 70 years of time of application of this material. This is a radio transparent material, so it's very interesting for physicians in radiology. There is no limitation for some diagnostic procedures, like, for example, MRI, compared to those who had titanium implants. The material is inert to the patient body. We had some in the past. We had some nasty cases with the implantation of titanium implants, where the process of selective laser melting was not guided at higher quality. So after the production of the implant, some of the titanium particles remained unsintered, and after a certain time, those particles of titanium causes some problems for the patients. If I can remember, even some examples, there were some examples of a cancer. And after that, when the patient took the lawyers to sue the hospital, after maybe few such cases, the application of this type of implants and additive manufacturing in medicine generally decreases quite fast, and you have to you have to prove that this technology is good for additive manufacturing after another maybe 50 or 100 good examples, so that you can get this trust in those technologies again, like this trust was before those cases. But in the meantime, producers of the material, of the technologies, of the printers, of the quality assessment and quality management softwares put a lot of effort so that this is not happen anymore. So today, after production of titanium implant, the titanium implant will go in a CT scanning in order to check if there is something that is not permissible for built into the patient. In previous time, it was not the case at the beginning of application of those technologies. So we also have, as I already told you, when you apply bone cements, you can possibility to apply antibiotics on the patient through the material. As I know, this is the only material that allows such a treatment of the patient, but maybe I'm wrong, but according to my knowledge, it's the only one. Okay, with application of additive manufacturing molds, we can really adjust the shape of the implant made from bone cement, tailored to the patient. We have those examples are not in this presentation, but we have much more complex geometries that we solved with this approach, with our additive manufacturing molds. So by production, those tailor-made implants, you can expect better prognosis for the patient, reduce time for the surgery, and of course the faster patient recovery. And I should say that especially in these cases that you have seen, that you have the opportunity to see in my presentation, especially for this young girl, it's very important that we really produce a good implant which fits perfectly on his skull, because she's a young woman, and I should say that she takes a lot of attention to her look. So it's quite also important that you can achieve a higher level of satisfaction after the surgery, but not only for a patient, because when we spoke with those surgeons from Osijek in 2014, and when they describe us how they produce the implants, they said that they are also very sad or angry when they cannot fit, when they cannot shape the implant as they wanted to. So this is not only a question of satisfaction of the patient, but also satisfaction of the surgeons. And with this approach, we can get a high level of both. So thank you very much for your attention. And this is all from my short presentation. Okay, I have one question here, maybe. Question about patient with 3D mandible graft. Are you familiar with the pathology? I'm not sure if okay. I'm not sure if he went under this radiotherapy, but I think that this was he was hit as a younger person by horse, and some pathology was present there, but I'm not sure that it was a cancer and that point at that time. So my colleague Miodrag Katalenic is also was involved in this project. Maybe he knows more about the patient at that time. So Miodrag, maybe. You can talk now. You have you have Sven's picture. Okay, he's not with us, but I think that there were no radiotherapy before. Okay. This is the monumental. Okay, I hope that I answered your question. So, if there is no question more, I will conclude this workshop with a few words about future maybe of additive manufacturing in this medical application. And of course, everyone is invited to make your own comments. First of all, you can see that materials are very important part of future development and future application of additive manufacturing within this medical sector. So I can expect not only in medical sector but also in technique, tool making, transportation, and so on. I can see next great revolution in these areas, but in case of application of additive manufacturing, in developing of new materials, and these new materials can open really new areas of application and maybe new ways of using additive manufacturing in those sectors. As I have mentioned at the beginning of this workshop in introduction of our project, for example, functional graded additive manufacturing maybe can offer great tools for future application. Of course, biomedical printing is also very important and very interesting for this area. 4D printing can be very interesting. So we can expect next huge step in this area only if we can, only if new materials will be developed. And if we are speaking about medical application, then probably there's bioprinting, technologies and materials for bioprinting will be very interesting, a very interesting area of additive manufacturing. Also, new tools for scanning, tools for modeling will also help to develop application of additive manufacturing in this medical sector. This is only my opinion, but I think that I'm not wrong. And I would like to ask every one of you, if you have any questions, any comments, please let me know, and I can allow you to speak if you want to speak, if you are attendees, and of course, if you are panelists, you can speak directly. This is a question maybe for defects in the knees. We saw some of the projects from Luis this morning, but the team from IDEM had some other obligations. So David, I will save your questions, and I'll put some questions into my partners. And as I can see here, Vyacheslav already had answered to you. So Vyacheslav, thank you. But I will also ask about your question also to the guys from IDEM. So if there is no further question, again, I would like to thank first of all the presenters and of course all the attendees to spend a few hours with us. I hope that you found something for you that is interesting for your knowledge, experience, and that you can use it also. Some of the information that you heard today in your future work. I also hope that we will encourage a kind of networking with this workshop. As I already told you, all the attendees are registered already in our platform, so you can ask questions through the platform and you can ask for a cooperation for our other platform. And also I would like to invite you on 17th December when we will have maybe a little bit more demonstration. It will be more demonstration about how to model for a medical application of additive manufacturing in different areas. I hope that we will also have interesting presentations for that our summer school in 3 weeks. Therefore, you are all invited, but I will send you official invitation as soon as I will have, and as soon as I will have a final agenda for this event for 3 weeks. So thank you again once again. Thank you very much, and have a nice weekend and take care. Thank you.
Thank you. Bye.
Bye.
Thank you. Bye.
Bye bye.
Thank you very much. Goodbye. Have a good weekend.
Bye.